Good afternoon, everybody. Thank you for coming out again to our ACAP presentation for today. Today we're gonna have a great session. Brandon will introduce our speaker there. So my name is Ron. I'm with one of the coordinators or lead team members for this overhaul. Thought I was doing pretty good on my volume, but
Accessibility.
Again, welcome to ACAP. We have a lot of food in the back, so please, if you are still hungry, jump up and grab yourself a little bit more. We're going to be eating chicken tenders for the next 3 days here, if you don't. So today we're having a great session. When we have these sessions, we'll typically have one of our core team lead members do a little bit of presentation about what they do as a business, and then sometimes we'll have some additional sponsors that are part of the food and are sponsoring us overall. But today we're going to start out, and we'll ask Dr. Brandon Archie to come up, and she will talk a little bit about her business, what she does with her business and how part of ACAP, and then she'll introduce our wonderful guest speaker.
Hi, everybody. Thank you so much for coming. I'm Dr. Brandon Archie. I'm an occupational therapist, so it's our job to help make sure people can be safe and independent, taking care of themselves as best as they can. And maybe the person can't be independent, but it's our job to help make sure caregivers can make their caregiving job as easy as possible. And so we do that at Ask Sammy by giving you tools to make that work. So if you go to AskSammy.com, you can talk to Sammy and say, hey, I'm taking care of my mother-in-law and she won't take her meds on time. What can I do? And it'll give you a list of products, services, and resources that could help you with the situation tailored to your needs. So that's there as a resource for you as caregivers. You can find answers 24/7, even if you don't have an OT in your pocket. Now you do if you use AskSammy.com. So I'm also going to introduce our speaker, Laura Gilman, known as your ritualist, also my friend. With over 15 years of experience, she's walked alongside individuals through some of their toughest moments, from elders facing housing insecurity, Jewish family services, to people navigating terminal illness, and now to families confronting some deep loss. She's a licensed clinical social worker in both Kansas and Missouri, and is also an ordained minister through the Universal Brotherhood. And she combines her clinical insight, spiritual wisdom, and ritual practice with her work. And she's an awesome person to talk about the topic today, which is recognizing and reducing caregiver compassion fatigue, as it draws from both her clinical and spiritual experience. So please help me welcome Laura.
It's louder now. This is better. Yeah. It's like the middle of the thing. Yeah. Say it again. So I got a little bit of a leash. Talk about now, you're getting better now. Yes, okay, good. Good. If you can't hear, I love it. Speak up. If you can't hear, you just flag me. I don't see you. Okay, good. I'm so really, this is as far as I can take it, but I'm glad to continue over the podium because if I were standing behind you. I'm so glad to be here. As Brandy said, my name is Laura. This is clinical social worker. I'll tell you a little bit about myself later. But I wanted to start our presentation just by taking a minute to sort of go into our thoughts, go into our hearts. When I say the word caregiver, what comes to you? What floats up to you? So just take a minute, do a little inventory. Caregiving is very personal. All of us will be engaged in caregiving at some point and at any points in our lives. Does anyone feel comfortable sharing what came to them when we asked ourselves about the word caregiving? Yes, thank you. So I was thinking of my mother-in-law, and she placed her mom, my grandma, in an assisted living facility, and she wanted to keep her in this living section. So she would drive back and forth to her house every day in the morning
give her mom meds, get her ready in the morning, and she come back at night. And so to me, it's like commitment. And she put her, like, her mother was living in a facility that's like right by her house. Just every day.
Yeah, helping her with all of those activities in daily living, even though she was in a supportive living environment. That's such a great, I love that came to you. What else? When we hear and think and feel about the word caregiver, yes, servant's heart. Servant's heart. I love that. Yeah, it takes a lot of heart to caregive. Anyone else?
Exhausting.
Exhaustion. Yeah, we're going to talk about that exhaustion. Yes. And we're going to talk about the difference between compassion satisfaction and compassion fatigue. Compassion fatigue is when we're at this exhaustion. Yeah. Thank you for being brave and saying that. Yes.
I'm not saying I'm there yet. It is about so sweet, but what about resentment?
Resentment. Yes.
And we don't.
Yeah. I didn't choose this, right? I didn't expect to be in this role. Great. Yeah, there's a shadow side. We're going to talk about all of it today. Anyone else? Any other thoughts about caregiving? Thoughts, feelings, sensations, memories? Yeah.
And I just got my last myself. And it's a health concern recently. And I'm like, oh my gosh. It's continued.
Yeah. We might think we're finished with one caregiving role, only to find ourselves in another caregiving role. Yeah, we're going to talk about that double and triple duty. We're literally going to talk about that. Good. Everyone's on. You can all do this. You're doing a great job. You're doing a great job. Okay, I'm going to do my best to toggle. Short arms, short leg. We're going to do it. We're going to do it. So who is this lady? Like, who is this lady up here talking? I have the privilege of journeying with many caregivers in the many roles that I held as a social worker. So I started in Baltimore City hospitals, and I was on an orthopedic unit, so I had a lot of people with joint replacements. And then I was on a geriatric unit, so I had a lot of people with aging-related illness. I got to meet and learn from so many caregivers in these roles. Like we always say, that's the job of the social worker. Our clients are our best teachers, right? We learn from everyone. So in the hospital, I learned alongside a lot of caregivers. I learned that not everyone has, I was part of a palliative care team, not everyone has the same ideas about what, how long they want to live, under what conditions they'd like to live. There was a lot of good learning there. I then went to an adult day that served individuals with dementia. So here I got to journey with families long term, right? So their loved one had a progressive illness. Many of us may be experiencing that too in our lives, right? Our caregiving journeys, right? You might think that they're over, and they might start in a different way, with a different, set of family members, a different role. When we have individuals with progressive illnesses, you have, as a helper, you have the privilege of journeying with those families long term. And the caregiving role can be really exhausting, right? Like, I didn't expect to be here. I didn't choose this. So that's what I experienced there. I worked hospice after that, so, working with people at the end of life and their loved ones and bridging a lot of communication, right? The people that we care for might not have the same thinking about what care looks like for them, what quality of life looks like for them. So that was big learning in hospice. And kind of bridging that. How do we bridge for family members? And then I worked for not until about a year and a half ago, I worked at Jewish Family Services. I started to speak and became the director of social workers. A lot of caregiving work there, mostly with Holocaust survivors and their families. So all that to say, I have been lucky to learn alongside a lot of caregivers over the years. And in this picture, I find myself a caregiver of two small children who made me a waffle cake on my 40th birthday. Is that cool or not? It's delicious. And I bring this picture also just to kind of echo what you said in the back. At some point in our caregiving roles, I had this realization, and we all will. There's a time where we have compassion, satisfaction, where we feel really filled by the caregiving that we're doing. And at some point, the caregiving gives us perspective to say, hey, I'm not showing up in the ways that I want to, I'm showing up with the quality of, humanity that I want to. And I had a moment like that after 12 years of great nonprofit. And I said, you know what, like, I've gotta pivot, I gotta do something different, do a different dance here. And so I started my own business, just getting to do all the things that I wanted to do through the years. So now I work as a therapist and hypnotherapist. I do ritual and ceremonies, so I'm officiating a wedding in November. I get to do baby namings, funerals, all the things of life cycles. I do groups, I get to teach like this, and then I'm also an end of life doula, so I sit with families, caregivers, individuals who are dying, and help them live with quality of life for the rest of their life. All of us are caregivers. All of us are caregivers. So I'm going to share some statistics about caregiving. They were surprising to me, and I'm steeped in this work. So I thought it was really important to give some context about what caregiving looks like in America. So we are a country of 340 million people. 100 million adults in the United States are engaged in caregiving. So it could be caregiving for children, caregiving for a parent or another relative. And then 63 million of these 100 million caregivers, so the majority, are caregiving for a spouse, a parent, an older adult relative, or a special needs child. So the majority of that 100 million people who are caregiving are not caregiving for children. Older people emancipate in the house, right? They might be caring for a child with special needs. So that's a long-term caregiving role. Not like what you said, which is so wise, like, I got them out the house, right? So some parents won't be able to get their kids out of the house, and that's a long-term caregiving role. We're going to talk about all of this today. If anyone has questions, like, just give me a finger and ready for you. We want to learn together. So, double and triple duty, we talked about this, right? Some statistics about who is caregiving and what that looks like. Men account for 38% of our family caregivers. So we have a lot of people who might work for home care companies, right? People, professionals who come into the house to caregive. Right now, today, we're talking about family or informal caregivers. So I want to qualify that. People who are not compensated to do the work of caregiving, which is a lot of us in America. So of these family caregivers, 68% of them are male. 38% of them are male, and 62% of them are female. The average family caregiver, this was pretty staggering to me, spends 27 hours a week caregiving. 27 hours a week caregiving. That's, more than a half-time job, right? 70% of these family caregivers are also working. And about 25% of family caregivers are working full-time. So we say 40 hours a week is full-time, and the average caregiver is doing 27 hours of caregiving. These people are working double, triple duty. And it's not, I don't have an image of this, but so importantly, a quarter of family caregivers also have children in their home, right? So we talk about the sandwich generation. There are so many layers of caregiving happening in one house, in one family, in one situation. Lots and lots of levels of layers. Any questions, comments, experiences? Okay, here's all of us, so speak up. Did I get everything here? Yes. Something I just want to point out that was pretty surprising to me. So the bottom statistic here, 24% of family caregivers provide 41 hours or more of care a week. That's almost, a fourth of family caregivers providing a full 40 hours of full-time work week of care plus. So that was pretty interesting. Yeah. And I like that too. Okay, that's a lot. It's a lot. So 65% of family caregivers are providing assistance with activities of daily living. So activities of daily living, I always say, are things we have to do in a given day. Going to the bathroom, eating a meal, getting dressed, usually showering, if not every day, then every other day. Transferring from beds, chairs, mobility work. And on average, these caregivers are providing assistance. The statistic is 1.9, but on average, we're going to round up, they're providing assistance with 2 of these activities of daily living. So the work is intense and it's heavy work, right? It's heavy work and it's day-to-day work. It's day-to-day work. 40%, I thought this was interesting, and Sherry and I had a conversation about this earlier. 40% of caregivers live with their care recipient. So that means that they share the same, not that they're living with the person getting care, but that they share the same home. So that's interesting, right? In terms of like having space from the person you're providing care to, having like a little bit of distance, time for self-care, something to think about. And then on the flip side, having to go to, if you are providing care for a care recipient who's in, like you mentioned in assisted living, having that time to transport and get to them, is another sort of something to think about. It's another something to think about. So this I think is very important. Randy, we talked about training codes, we talked about codes under Medicare. So only 11% of caregivers providing care to someone receive training on how to provide care. Only 11%. Super low. Of this 11%, these are the professionals who train them. And the reason I bring this up is because I want you all to be empowered with this information. Medicare has codes that professionals, doctors actually handle for the caregiver training codes, but the nurses can, physical therapists can, nurse practitioners and physician assistants can, care managers, social workers can, occupational therapists can. There are codes that we can bill Medicare in order to have that time to train someone on how to assist with activities of daily living and instrumental activities too. So only 11% of caregivers are getting this training, but it's available to us and it's underused. I think it's really underutilized. So if you are someone who might be needing training, keep that in your back pocket, right? There are ways to build Medicare for training as a caregiver. You can receive training as a caregiver. We talked about this, right? Sandwich between caregiving duties, paid work. Like it could be a kind of paid work, but it could be a lot of paid work. It's not surprising that 41% of family caregivers self-report low overall well-being. And that low overall well-being is higher than their non-caregiver. Yeah, why do we think that we're reporting low overall? What do you think contributes to that? Yes. Exhaustion. Thank you. What else? Stress. Thank you. What else? What's contributing to this? Yes.
You also don't have time to go check on your own health care center.
Totally. Time, right? Time for self-care. Time for personal health, right? Support. Lack of support. Yes. Yes. What else? These are great. These are great answers.
Financial piece, take time off of work. So
Totally. Sarah, you're leading us to our next year right on the same wavelength. Yes. Yes. So physically, mental and emotional wellness, financial wellness, yeah. Caregivers report lower overall. Yes. For all these reasons. So that's not a good thing. She goes like that. Bigger. So you can see here over the course of the last decade, the prevalence, the numbers of family caregivers have grown by about 10 million each 5-year increments, right? Each 5-year increment. So the number of family caregivers continues to grow. And I think we put a lot more thought into it. I think we paid a lot more attention to it since COVID. I will say that I think COVID, a situation where all of us were having to engage our caregiver roles because we were children at home, our children were in school, if our loved ones were in places where they were getting care, some of us took them home, or we were limited in the ways we could see them. So I think we've been paying a lot more attention to this since COVID, and the numbers are steadily increasing of people who are engaging in family caregiving. Any questions? Not yet. So this is an assessment tool that you could mention to a provider if you wanted. This is a professional quality of life scale. And it measures, we talked about this, right? It measures for compassion fatigue, caregiver compassion fatigue. And there are three domains that it assesses. This compassion satisfaction. That's right, that's like the opposite of compassion fatigue. So compassion satisfaction is an extent to which doing emotional labor aids in meaning. Has anyone had a caregiver role where they felt that the work of caregiving was adding to their meaning? Yeah, what was that? Kim, what role was that? Fulfilling. Which role? Which role was fulfilling to you in particular?
Yeah, sandwich also.
Yeah.
Just seeing that they feel like it's
Yeah, showing up for people. Yeah, that's a great example. Anyone else? What have you experienced compassion satisfaction? Or showing up in caregiving felt like it added to the meaning of your life? Yeah, Jen.
when my daughter went to speaking about
That's so beautiful, but it feels like part of like a full circle moment. Oh my gosh, this woman spent time taking care of me, and now I have the privilege of taking care of her. I love that full circle moment. No one has said kids. Has that been meaningful? Anyone? Usually that's the low hanging fruit, but sometimes not.
But my daughter and I were in therapy at children.
You're
Caregiving.
yes. You say it again. You and your
My dog, we were.
okay. I thought you said dog, but I didn't want to do that with dog. Okay, you and your dog
Therapy at children's first.
went to pet therapy, Children's Mercy. So special. You provided pet therapy or you received pet therapy?
Provide.
Awesome, right? So you were able to show up, and that felt super meaningful to be able to lend that skill set. That's so special. No one, not no one, but very few people from educations, right? This down is pretty big. Too loud? Okay. Okay, this is fine. So compassion satisfaction, we know what that looks like. Burnout, which we've talked about also. Exhaustion and overwhelm. This is where many caregivers find themselves. What's the situation where we felt in burnout? What's an example of when we felt burnt out? I had a moment when I was working 50 hours a week for 12 years, and I realized I hadn't cooked a dinner with vegetables for my kids. Like Chipotle, the cilantro and the Chipotle rice was the only green thing they were supposed to eat. So I had to say, this feels like not how I want to show up. I'd like to teach them. They still don't eat green vegetables, so I'm kidding, but at least I felt like I made an effort. I could expose them to it. But yeah, I had a moment where I was like, this is not how I show up. I'm sitting on my wheels and working a lot, able to show up in this other space that I need to be present. What else have we experienced for now? This is a hard one to share, I know. But if you feel brave, we'd love to hear from you because other people are there too. Yes.
I think for me, I'm a hospice social worker, so caregiver compassion all day long. And recently, my mother-in-law had surgery, didn't go as expected, so she moved in with us. And when I get home, it's been about 3 months now. So now I'm feeling the burnout. I work every day. I do this all day. When I get home, it's not the first thing I want to do is go check on you, see you, and you follow.
Thank you for sharing. That's so important. And we talk, right? When a care recipient is in your home, it's and that's your place of safety, of apron, and you come home and you've got enough to pour out more, and you're well needed filling, for sure. For sure.
To the point where I feel like when I go home and do stuff.
Yes, yes. Yeah, it's a great example. Thank you for sharing. Anyone else? Burnout. When do we find ourselves in burnout? Yeah. Yes. In the middle of the night. Yeah, the dark hours of the night are a big time for burnout. Yeah. The dark hours of the night when anyone won't stop crying. It's a great example. What else? Anyone else have an experience of burnout they want to share? Okay. And then the secondary trauma, which refers to intrusiveness at work, avoidance and startup related to that, whatever that stimulus is. And that's what you're experiencing, right? Work is, you feel a lot of compassion satisfaction when you do your job. When you come home and have to do more of that, you start to want to avoid. Yeah. Because it's just too much, right? We all have a threshold. Everyone's threshold is different. But recognizing that you're over your threshold is brave and awesome. Yeah. Anyone else? Any other comment, experiences we want to talk about? I'm a social worker. Everything's kind of a group therapy session. So caregiver remixes this is your space. This is the space and the place. Oh, that's so funny. None of my pictures are like doing their thing, but that's okay. What should be happening in this picture is Donald Duck coming through the door and like falling on his face. That's what he does, but I'll just describe it to you. So what does this look like for individuals? What does caregiver compassion fatigue look like for individuals? We know that our family caregivers are caring for multiple generations at once. They're engaging multiple roles. And so compassion fatigue can look like mental symptoms of irritability, frustration, anxiety, emotional numbness, not having any work, right? We have limits to our ability to feel compassion for sure. It can look like physical symptoms of headache, muscle aches, digestive issues. It can show up in that way for us. And then it can impact our quality of life. We can have difficulty sleeping, fatigue associated with that, and a general sense of purposelessness. So on the compassion satisfaction side, we feel purpose in our work. On the compassion fatigue side, we feel a purposelessness, right? Which really comes from overwhelm. When we're overwhelmed, we can't make a meeting. When we're overwhelmed, we can't make a meeting. It's harder. So we talked about just now the way that this shows up for individuals. And I want to talk to you a little bit about what this looks like in society. Half of working caregivers report work disruption related to caregiving. So half of working caregivers say, my caregiving role impacts the way I show up at work. This could look like going in late, leaving work early, or taking off needing to call out of work. I'm bringing this up because I think it's very important, especially as we have a general, many people taking care of children and parents. There are major access differences to benefits at work for salaried employees and hourly employees. And neither of these camps are free from caregiving duties, so that's why this is important. So telecommuting option, right? The ability to join a call or a meeting virtually if you have a kid at home, a parent who's ill and needs your presence there, right? You could still work, but someone needs your presence in your home. 58% of salaried employees have access to a telecommuting option, while only 23% of hourly employees have access to a telecommuting option. So our hourly employees are going to be much more likely to call in because they don't have the option of joining virtually. They don't have that flexibility. So paid family leave, right? The ability to call out when we need to call code. 60% of salaried employees have access to this, while 35% of hourly employees have access to this. Right, so the ability to call out when you need to take care of a family member. And then paid sick leave. So I would say family leave is specifically for taking care of family. Sick leave is anytime, right? Anytime there's an illness. 78% of salaried employees have access to this benefit, and only 55% of hourly employees have access to it. Right? So the ways that we can show up for our caregiving jobs are definitely impacted by the ways that our employer kind of make it possible. And then the last category refers to a variety of employee assistance programs. So it could be counseling, it could be information referral. 43% of salaried employees have access to this, and 27% of hourly employees have access to this. So it could be access to like a geriatric care manager to help you find care for your parent, to find rehab for them. And there's a disparity there too. So respite services are something very helpful for caregivers. Has anyone here availed themselves of respite? There are many available. Has anyone been able to avail themselves of respite? Okay. So when asked about services that would be helpful, caregivers said, if it was available to me, 13% of caregivers said, I have taken myself up on respite services. And another almost 40% said, this is what we need. We need respite services. Respite services could be in the Northland, at Northland Shepherd Center. There's a break time program. So it's like an adult day program where an adult care recipient can go and engage and do fun things, and the caregiver can have a break. Respite means it's a fancy flip over for free. So these services, I think, are important, and we don't have enough of them. So where can we turn for help locally? Mid-America Regional Council is a hub, is an organization that's a planning hub for 5 counties in Missouri. They provide information referral, so if you had a question about resources, you could call and get answers. They provide training and classes, and they also provide a connection to local respite services. So they would be able to tell you about the Northland Shepherd Center's Break Time program for any of the respite services in your area. They do serve 5 counties in Missouri. On the Kansas side, you could also call the area agency on aging. It's interesting, they didn't have a specific caregiver service, so I didn't put them on here, but you could also call the area agency on aging on the Kansas side. Similar organization, just a different side of the state line. Sandwich KC is an organization that serves specifically, like the name, right? People who are sandwiched between caregiving roles, and they also provide information referral. Training. They have a monthly virtual support group, and they provide one-on-one coaching for caregivers, which is pretty unique. They serve the metro, both sides. The Alzheimer's Association has support groups for caregivers. Go to the picture of that. Good. And I can also provide this PowerPoint. And then the Church of the Resurrection has specific caregiver support group, and it's ecumenical, so it's everyone. You don't have to be Baptist to attend. But these are some of our local resources. Any questions? Any reviews? Have anyone been to any of these resources and have feedback? No, not yet. Not yet. Okay. I just need to bring this because it's accessible and it's evidence-based. So if you have 5 minutes of time and your care is being maybe honest with you and you need just a minute to kind of recalibrate, this is the emotional freedom technique. It's a clinical technique that the goal is to shift your energy. You know, the goal of a walk is to shift your energy. Sometimes you can't get out for a walk. Sometimes you can't get out for a walk. The weather doesn't cooperate, your body doesn't cooperate. So I wanted to teach just a little skill together today. So this is the emotional freedom technique. I'm going to have you practice it on your body if that's successful to you while I teach it, okay? Just so we can do some practice. I don't think I'll be able to hold this when I do it, because I need 2 hands. So the emotional freedom technique
uses tapping to kind of realign. So we're gonna do it. So we're gonna do outer palm. Good. It doesn't matter which hand. Center of your head. Between your eyebrows. Your temples. Good. Below the eye. Below your nose. Between your bottom lip and chin. Right here on your chest. And then right at your rib cage. Good. And you would do it the other way too. So let's do our other hand. Good. Top of our head. Breathe between your eyebrows. On your temples. Below your eyes. Right below your nose. Between bottom lip and chin. On your chest. Right at your ribs. Good. Thank you. Good. Good. While you're doing this,
While you're doing that, you can say something to yourself in the present tense, like, I am overwhelmed, and yet I show up capably. Or I am stressed, and still I show up feeling grounded. So whatever you need to hear, worst case scenario, you just made some taps on your body, right? Very low risk, very low risk, very low risk. If you don't like it, don't do it. But this is really, if you have 5 minutes in a closet, in a bathroom, this is evidence-based. There's actually a review of more than 50 studies that found it to be moderately to very effective. So you find your intention, and making your intention present tense helps our brain understand it and embody it more effectively. So you would say to yourself, does anyone have an intention that they use? Does anyone have something they need to embody? Should we make one together? What are we needing when we're showing up to caregiver? I think you have one. What are you needing? Anything?
I'm usually I love it.
I am love and I am faith. Love that. Oh, I love that. I am love and I am safe. Love that. That's a good one. I am grounded. Yes.
I found that areas where you have a lot of self-doubt, discouragement in your life, that's it's a self-holder. It starts to speak out who are caregiving. Whether it's children, if you know, you go to that place, it all it's about something for the negative habits first. So the miss is really so much. It's really helpful. Calm, stress out. I got it.
Totally. Yeah. We say often that as we parent, we're reparenting ourselves. Right? As you parent children, you reparent yourself. As you caregive, you're kind of rewriting the caregiving that you received. Yes. I love that. I love that. Okay. If anyone does want to create an affirmation, we're here for it. We'll have some fun. So here's my future casting. There are no perfect solutions. And not in Kansas City, anywhere. I think this is an area with a lot of potential for growth, for investment. Caregiving will impact all of us. Investing on the front end in caregiver supports and resources is good for all of us in the long term, right? So the more proactive we can be, the more well cared for we can be. And caregivers, we talked about that wellness, the low self-assessed wellness. If we can help support caregivers, we're supporting the whole family, we're supporting the whole workforce, we're supporting the whole country, right? So, I said working together results in the greatest fields. And it's going to take everyone, right? This isn't like our employers can't fix this for us. Our elected officials can't fix much of anything. States can't fix anything. It's going to take everyone. It's going to take everyone. Public funding, private funding. It's going to take our spiritual communities. And the more we work together, the more effective we'll be in creating innovative solutions and innovative resources for caregivers. And you know, everyone's gonna be a caregiver, so it's worth it. It's worth it to invest in this. Anyone else? Thoughts, feelings, experiences? Yeah.
When you talk about there not being enough training,
Mm-hmm.
a lot of caregivers are very insecure.
Mm-hmm.
So their affirmation could be, I am enough. I can do this. It might not be perfect, but I can step forward and try.
I love that. I am enough. I am doing my best. Yeah, that's so beautiful. I am enough. And I want everyone here to feel empowered. Now you know we can build Medicare for caregiver training. So say it to your next appointment, your loved one's next appointment. Ask the doctors who not build it. All of the other professionals in that space can build for caregiver support. Ask your doctor. I always say an order from a doctor is like currency. It's currency. So you have access to that, and I want you to know that you have access to that. 11% of caregivers are receiving training. Yeah. And I'm excited with it. I'm enough, right? I'm doing the best I can with what I have, with the resources I have. Beautiful. So these are my references. Please read, look, there's a lot of good research on caregiving, a lot of robust research. And then this is me. Who has questions? Oh, here, what can I go back? Want me to go back on your questions? Back. Here we go. And I can send this, Kim has this, we can send this out to anyone who wants this. I can get your email and send it to you. I've got cards on the table. Happy to get anyone information that would be helpful. Any questions? Comments? Yes.
I'm not a professional. I've been for years. I am a caregiver. I have help. I have a spare bedroom that I put all this medical information in. Okay? And I never take a look at it. But I would have loved to have some of the print, especially that one thing about if you get now, I could have sent it to okay, then I have to have a thing that will download it, okay? Okay. But I'm not gonna
If you send it to me and Ms. Sandy comes over, it's up to what we should do.
I'm one of those that is definitely, and our daughter has done some stuff with our computer stuff, and I don't even have a television with us anymore.
Technical, right? Tech is not reliable. I feel it. I get it. Tech is not reliable. Yes. And yeah, just to even print out that emotional freedom technique, it's interesting. I don't know. You know,
There's sort of this like a tension in the world of mental health. There are so many helpful skills and tools that we have, and there are people selling those things. And so sometimes it's hard to access them. What I love is the man who developed the emotional freedom technique was like, this is for the good of everyone. Like, use it. So it's accessible. It's accessible and it's easy to use. And worst case scenario, you just tap on your body a little too much, you just shake it off. Right? The side effects are minimal. Side effects are minimal, unlike medications, where sometimes get really hard for us. Any other questions? Yes.
I think one thing that happens is we don't have conversations about caregiving until we go into the caregiving role versus starting to talk about those things early on. So siblings can start making kind of decisions or asking parents or whatever that might be. Like, you know, they like what their wishes and choices are. I was always the social worker at Christmas dinner asking these questions or having a conversation.
and thank goodness you were.
Yeah, no. Where, but not everybody can have that. I realize it. But it is something families maybe should think of before you're actually having to be in that position.
Such a good point. There is a cool game called Go Wish, and it's about your care wants, your like what you want. And it's a game, so you could really break, you could make it a little more palatable of just sitting down and saying like, what do you want in terms of care? What does the most important question to ask is what does quality of life look like to you? And what does not look like quality of life to you? Right? So like how many of us in here have advanced directives? Have end of life, just an advanced directive, have your healthcare wishes documented.
that would be something else I should send to Kim. The Center for Practical Bioethics has a double-side document. It's so important to have a healthcare agent. It's so important. There's literally just a little section on the back that I would always fill out with clients. Quality of life to me looks like, one of them said, having clean hair. For me, I mean, Grammy and I just said this. My mother-in-law always says, there are people who live to eat and people who eat to live, right? I live to eat. Like if I cannot have food by mouth ongoing, I'm done. And that's okay. And if someone else could have, maybe I change my mind in the moment, but like eating is everything to me. So I probably won't change my mind. So having those quality of life values documented, having the conversations is so important. I just sat with the family at KU. The father I'm an end-of-life doula. The father, they didn't know what was going on, but he had slept in a chair and his wife came down. He was just like kind of out of it. Oh, yeah. Want to be able to talk to everyone.
Okay, I didn't have a short leash. I went to the KU. She didn't know what was going on, but when the morning came and he was very out of it, he realized that they needed medical attention. He had a DNR. He was not old. He was 70 something, maybe mid-70s. He was not old. He had a DNR in his power of attorney document. But when you call 911, their directive is to resuscitate. So that's something else to do. If you do not want to be resuscitated, make sure your family knows. That means that if you find me out of it, I don't want you to call 911 because they will resuscitate you. So if I have clients with do not resuscitate orders, I put it on the front door in a plastic sleeve so that everyone can see it if someone does call 911. But we went to KU, I met with the family. Of course, when he got there, they stabilized him. He was intubated. He was, there were things being done to his body that he didn't want. So having this, and they did the best with what they could, right? They did the best with what they could, and when they realized it was not going to get better, they extubated him. And so I was there for that, which was meaningful. But you're right, Sherry, like what does quality of life look like to us? And we want the people we love to know. And we also want to document it. Both are important. And now more and more hospitals, like when I gave birth, had been asked, do you have an advanced directive? And I had to upload it, which is good. So they have a copy of it in their system. More and more, I think medical systems are doing a good job of seeing those questions and soliciting the information so that they're in the know too. But yeah, it's so important. And I love what my client said, which is not like, she's like, Laura, when I don't have clean hair, like, it's miserable for me. And so we wash her hair in the hospital, to make sure that she felt like herself. We want to live like ourselves. For the extent of our lifespan. Yes.
Positive and wise. I just wanted to pick your brain. When talking about caregiving like babies or innocent times, but what if you're caregiving a very innocent life situation, but when it gets very difficult, it happens so often, and it's so sad, there's anger or even. So talk to us a bit about hang on as a caregiver, basically when that added level of where that is that causes people so difficult.
Such a good question. What do you do when your caregiving experience is really unpleasant? Maybe the care recipient is agitated, angry, mean. It's a great question. I wish I had an easy answer. One thing that I would just say, listen, Medicare covers mental health counseling. It's a $25 copay. If you're a caregiver, it's so cliche, but even if you can't put your mask on first, put your mask on at some point. Find someone to talk to. Find someone who will allow you to yell and express the frustration that you're absorbing from that care recipient. Not all journeys are beautiful. They aren't. And you know what I say to my clients all the time? We do not choose our suffering in this life. We don't get to choose our suffering. And there's suffering all around, right? We don't get to choose the suffering that sucks. And I'm not like one of those people who's like, but you can cope with anything. No, sometimes it's very hard to cope. So know that you have that, our insurance or no. Anyway, not perfect. Nothing here is going so perfectly. Insurance isn't working for all the time. And mental health counseling, not all plans, but most plans do cover mental health counseling. Find a therapist who will allow you to promote and express the things that are hard. Find a space where you can do that. Find a support group where you can do that. Go outside and scream. Or find a therapist who will train you to go outside and scream. Yeah, because it's not always fun. Yeah, there's such a shadow side. And that's why we're talking about compassion fatigue. Because it's real. And it's costly to our spirits. And it's costly to our community. Yeah. Yes.
For a courageous. It is such a great task, and I think that as caregivers, we need to know that, and we need permission to not be okay, to go outside and scream. And I don't know about any of you, but there are times where, you go to a friend and you just kind of like hurl all this at them, right? And then you say, okay, thank you for letting me get that all out, now I can move on. I mean, there really is something that is nice about doing it, and so if that's the way to do it. I know for me, I think about my dad and, he's at that generation that doesn't listen, that doesn't act, or, we talk about it, we lead him to the water, he doesn't want to take a drink, that kind of thing. And when I feel myself getting so frustrated where I'm going to be disrespectful, I get up and I walk away. Because I know, like, for me, in my mind, I'm a little girl and he's Superman and he almost told me. I don't want to disrespect. Sometimes I'm just on the point of getting ready to like lose it. And I have to say, no, okay, go vent this out somewhere else. And then you got it out of your system. So you didn't just hold on to it. Just holding on to it. Just that's so that's beautiful. That's so beautiful.
Yeah, so beautiful. Yeah. And recognizing, which you recognize that like our idea of quality of life might be very drastically dramatically different. My parents literally, my dad's like, I have a stockpile of morphine. He's like, if I'm out of it, put me out. And I'm like, okay, Dad, I'm a professional, I'm not able to do that. And I hear your wish, and I'm like, keep it on. And you're thinking of very different wishes of your life. And my brother is not licensed professional, so he has that information. That's fine. Everyone makes their best choices. But just to know, we can lead someone water and they have the right to dehydration. Gosh, do they? And do you still have to run to the hospital when they're dehydrated and delirious? Yes. You still sometimes have to run to the hospital. And you feel dehydrated because you're running and running and running. And it is really tricky. We all have the right to make bad choices. It's like that's a hard pill to swallow, but we do. We all have the right to make bad choices for ourselves. And some of us do, yeah.
When my kids were young, we used to create co-workers where moms would get together and we would say, one night another mom is going to cook dinner for me. I have to do that. I don't have anything. I have to be irresponsible. I have to sit down. And it was a wonderful thing. So I started incorporating that. Then when COVID hit, kind of came to school, we had a 7 different families had this pattern that we're going to travel to their house, school our kids today. So it gave you a 1-day rest. And so we started. So I've been talking to some of our clients who truly cannot afford care.
Yeah.
And I'm just thinking about when you're going to be a caregiver, it's almost like you can start a co-op where you have other people that and you choose the qualifiers who you want to be your group and people who can know how to do certain things to help your loved one. But it's truly a day when you get to have the respite break, and because respite does come from those services, but it can't be just all the time. It's qualifiers. So if you created, I just feel like we have to, as a society, start thinking about how to help take care of ourselves because we can't depend on and they're wonderful institutions all the time. So we have to start ourselves. So I think if we'll do this as a group and start figuring out, pick 10 friends, you know what I'm saying, or different people, and give yourself a full, maybe a Monday, Thursday break.
That's beautiful. Yeah. And it gives you a nice community. Yeah. Love that. Any other comments, questions, experiences? I appreciate being here, and I appreciate all the hard work that everyone here does to care for people in your life, in your community. I know it's not easy. Keep tap your butt, keep tapping, keep tapping. Don't do nothing, and ask for caregiver training at your doctor. Thank you.
Thank you so much for that. It's really enlightening for everybody. Appreciate everybody coming out. A couple of announcements. Laura had mentioned a couple of places. One for Laura, if you send me your presentation, I'll send that out to everybody. And then in your talk, you gave a couple of shout outs to a couple of good organizations. One being Mark, Mid-America Regional Council, and also Sandwich KC. Both of those are community partners for ACAP. So they're listed on our website. So if you go to our website, you can scroll down and find either one of them. And try to get in touch with them, a little bit of information about them, how to get in touch with them as well. So you can Sandwich KC. They are having a Heartland Caregiver Conference coming up on the 1st of November. Anybody that's interested in that, again, you can go through our website. If you can't find it, you can go to their website, but there's a caregiver conference it goes from November 1st. It'll be here in St. Joseph. I think it goes from 10 until 4. There's some really great presentations and overviews and programs for people. If you can come up with that, you get a lot of information for anybody that's here. So our next program, we kind of been in a rush. We had our third Thursday sessions we're trying to do. And then we put one in the middle of one because we want to give everybody a little bit of information on Medicare before annual enrollment. And so we did 3 in a month. So we did every 2 weeks for a little bit. But now we're going back on our 1 per month schedule. So our next section is November 20th. How to have end of life conversations, and that will be presented by our sponsor for that will be Neil Funeral Homes, and our presenter will be Jenny for our team members here. So we're looking forward to that. We hope you can all join us. And thank you again for coming out. Grab a chicken finger on your way up, and I hope to see you next time as well. Thank you.